Hello everyone, welcome back to our channel. When it comes to OET clinical communication, signposting, it's very essential communication tool we use to guide conversation smoothly, especially in professional settings. It involves clearly signaling when the discussion transition from one topic to another. So this ensures that both parties remain aligned and avoids confusion, particularly when shifting focus to a new task or issue. Effective signposting phrases helps patients or clients follow the instructions or the conversation seamlessly. For example, instead of starting with the filler words like mm, which can sound unprofessional, we can use structured phrases such as okay, so, or now. Work as simple yet effective signposting. These brief cues signal a transition while maintaining clarity and confidence. Sometimes we can use longer phrases like, okay, let's move on. Thanks for that. Can we now talk about? So, when we talk like this means that we are wrap up one topic and starts the stage for the next, or we signals the introduction of new subject. Is it okay if we move on to the next point? It means that we are confirming that the current topic is complete before transitioning. So, by using signposting effectively, you can demonstrate attentiveness and professionalism, ensuring the patient feels heard and informed. And it is also very important to keep the conversation flowing logically, preventing any misunderstanding or delays due to abrupt topic changes. Without clear signpost, patient may feel like disoriented or uncertain about the direction of discussion, which can undermine their confidence in the conversation. Okay, let's see the next criteria organizing techniques in explanations. So, providing clear and structured explanation is very crucial aspect of healthcare communication because patients often receive a large amount of information in a very short time. And organizing this information helps them process and understand it effectively. You need to structure the explanation logically and clearly. Healthcare professionals can reduce a patient's mental strain and foster better healthcare outcomes. So, what is the importance of organizing explanation? When we explaining concepts such as treatments, lifestyle changes, or equipment usage, remember that even if you have delivered the explanation countless times, 100 times, or more than 1,000 times, it may be the first time the patient is hearing it, right? Imagine being in the patient's position, trying to observe critical information while possibly feeling anxious or overwhelmed. So, organizing explanation makes the process smoother for the patient and helps ensure they follow through with the advice or instructions given. Let's see some of the strategies for organizing explanation. You need to break down information into smaller parts. Instead of overwhelming the patient with a long explanation, divide the information into manageable chunks. Example, when you are explaining a treatment plan, start with the purpose of the treatment and also then move on to how it works, then finally discuss how the patient can adhere to it, and try to use simple and clear language. This is very important, isn't it? Try to avoid medical jargon unless necessary. If jargon is unavoidable, explain it in simple terms. Example, instead of saying you need to adhere to a low glycemic index diet, explain it as you should focus on eating habits that don't raise your blood sugar too quickly, like whole grains and vegetables. Provide examples for better understanding. Relating explanation to real life examples, which can help patients better grasp the context. If you are discussing weight management, explain how incorporating a 15-minute walk daily could be equivalent to burning of the calories in a small snack, and try to use step by step instructions. If the explanation involves a process, present it in a sequence of steps to follow and pause and check for understanding. Regularly check if the patient has understood what you have explained. Try to ask open ended questions. Like, can you tell me how you might follow this advice in your daily routine? Try to encourage patient involvement. Allow space for the patient to ask more questions or share their concerns. Their input can guide the explanation and make it more relevant to their needs. Let's see an example here. Here is a scenario where the doctor is explaining how to manage diabetes through lifestyle changes. The patient is saying like this: I'm really struggling to figure out how to manage my diabetes. There's just so much to remember and it's overwhelming. I understand it can feel overwhelming at first, but let's take it step by step. The first thing we'll focus on is your diet. You don't need to change everything at once. Start with small changes like switching sugary drinks for water or unsweetened tea. Do you think that's manageable? Yes, I think I can do that. Great. The second thing is monitoring your blood sugar levels regularly. This will help you see how different foods and activities affect your body. I'll show you how to use the glucose monitor in a moment. That's helpful. What about exercise? Exercise is also important, but it doesn't have to be too intense. You can just start with a 10-minute walk after meals. Over time, you can gradually increase the duration. How does that sound? I can give it a try. Perfect. Remember, these small steps can make a big difference over time. If you have any questions or if you feel unsure, let me know. Does this approach feel doable for you? Yes, it's much clearer now. Thank you. So, in this example, the doctor broke the information into manageable parts like diet, blood sugar monitoring, and exercise, making it easier for the patient to process. And the doctor avoided technical terms. He explained changes in everyday terms, such as swapping sugary drinks for water. And the doctor paused to ask if the patient could manage the proposed changes and encouraged feedback. And he is also acknowledging the patient concerns and offering reassurance, thus creating a supportive atmosphere that builds the patient's confidence. The doctor is also personalizing the recommendation, such as suggesting a short walk instead of intense exercise, which aligns with the patient's ability. And that's all for today's video. Hope you liked the session. Kindly like, share, subscribe for more OET tips. See you in the next video. Bye for now.